Hey, how's it going? All right. Hey, welcome to the live stream. Thanks for joining. If you have any questions, just drop them in the chat. Hey, what's up? Thanks for joining. So for those of you who don't know me, I'm Dr. Matthew Harb. I'm an orthopedic surgeon. I work in Washington, D.C. and Maryland. And I do a lot of outpatient or same-day hip and knee replacement operations. I would probably say about 70% of my procedures are outpatient or same-day surgery. Just hopping on here to do some live Ask Me Anythings or questions and answers. And I appreciate all the support for the channel so far. We've really grown a lot. And if you have any questions, just drop them in the chat and I'll go ahead and answer them. Just heard right side. Is there a nerve in the knee? It keeps bothering me. There are some nerves around the knee. There are some nerves on the skin around the knee. There's also some nerves underneath the patella, but you do have skin nerves and then you have deeper nerves as well. So yes, those can sometimes be affected, but a lot of the times it's more common for things to be affected inside the knee, like arthritis or meniscal tears or things like that. I work for Total Joint Ortho in Virginia. That's awesome. Where in Virginia? I did my fellowship training in University of Virginia. There's a lot of good private practices and orthopedic surgeons in Virginia. What did you score on your Mcat? The Mcat scoring was a little bit different. I scored a 36 on my Mcat. Can sciatica cause bilateral hip pain? And the answer is yes, it can cause bilateral hip pain. Usually sciatica happens more on one side than the other. And you feel a pain in the back of your knee that kind of radiates or goes down the leg. And that's what sciatica pain is. It can be from a pinched nerve, which could be from a bulging disc or from arthritis in the back. Can a bulging disc in the lower back be surgically repaired? Yes, part of it can be removed, and that's how you repair it. Hey, how's it going? Thanks for joining. For those of you who don't know me and who are joining, I'm an orthopedic surgeon. I do minimally invasive hip and knee replacement operations. I do outpatient or rapid recovery joint replacement as well. What advice would you give someone who's studying to take the Mcat? So I actually taught for the Princeton Review. I taught biology and I taught physics. And, take one of the prep courses. They're very helpful. Do the problems, do as much practice preparation as you can. And that's really helpful for the Mcat. Hey, what's up from South Carolina? Yeah, thanks for joining. I really appreciate all the support recently for the channel. We've grown a lot. There's a lot of new faces around here. Oxford partial knee replacement, not an easy recovery. 54 years old, very active. I think joint replacement is not to be taken lightly. It is a recovery. It is a major operation. And so you have to recover from that. And everyone recovers differently. I would say try not to compare your recovery to someone else because someone could recover faster, someone could recover slower. Yes, this is live. So if you have any questions, I'm doing an Ask Me Anything or questions and answers. And if you put some questions in the chat, I will get to them. Hey, I've been studying med for fun occasionally. Hopefully that helps you to get into medical school eventually. I would say the things to do, try and do research, try and get on board with mentors. Thanks for the likes, thanks for the follows, appreciate it. How long does it take to become an orthopedic surgeon? It takes about 14 years to become an orthopedic surgeon. You have 4 years of undergrad, you have 4 years of medical school, you have 5 years of residency, you have 1 year of a specialization fellowship, and then you can go into practice and become an orthopedic surgeon. Can doctors still do bursal removals on a swollen knee? Yes, I would say it's performed not that often. A bursa is the fluid-filled sac, which tendons tend to glide around. And a lot of the times we're injecting the bursa with cortisone if it's very inflamed. So we're not always doing surgical removals of bursa. It's not the best procedure and sometimes it can come back, but in very rare circumstances, if it doesn't go away, that's what we would do. My dad's numb his foot from sciatica. How does he get it back? You can do physical therapy. You can use anti-inflammatories. There's different neuromodulator medications. And so sometimes sciatica can be a really difficult problem to deal with, and it can sometimes be hard to get that feeling or function back. If it affects nerves, where he has numbness or he has motor dysfunction, then the treatment for sciatica would be some type of surgical treatment, or you could do an injection. Is it common to have pain after a total knee replacement surgery? Just had my second last week and it's worse pain than with my first. I would say no two knees are ever the same. It can be different as far as the recovery goes. Some knees are worse than others, so no recoveries are ever the same. And yes, it can be more painful for the second than it is for the first. Do I do any PAO surgeries? No, PAOs are big operations. They're usually for young patients with hip dysplasia. I'm not doing PAOs. A lot of the times the hip replacement could be a more predictable outcome than a PAO. So for me, I'm not doing them. I do hip replacements. What vendor do I use the most for knees? I use Stryker and Donjoy the most for knees. What kind of doctor am I? I'm an orthopedic surgeon, and I mostly do hip and knee replacements as well as some orthopedic trauma as well. What do I think about robotic assisted total joint replacement? I think we're trying to improve it. I don't think the techniques there are perfect yet, but we're trying to get better with those. My ilium is broken. What do I do? If your ilium is broken, a lot of the times we can treat it non-operatively. If it's broken into one of your joints, then or into the SI joint, then that may require surgical fixation. What's good for a torn meniscus? A torn meniscus is a shock absorber of your knee, and you can do things like physical therapy, anti-inflammatories, ice, brace. Sometimes you can do a cortisone injection. In the worst case scenario, if it doesn't get better, you can do what's called an arthroscopy, where you go in the knee with a camera. Thanks for the follows. I appreciate it. Thanks for all the double taps and likes. I sliced my finger and an orthopedic doctor stitched it back together. Isn't that a plastic surgeon's job? There's a lot of overlap between different specialties. For example, when I do a hip or knee replacement, I do what's called a plastic surgery closure, meaning I close the skin with a skin tape and glue. I try and make the incision very nice. So there is a lot of overlap between specialties. And, a hand surgeon can even do a lot of the things that a plastic surgeon does. An orthopedic trauma surgeon can do a lot of the same things as far as closures and techniques and things like that. So there is a lot of overlap, especially on closures. Doctor tells me I need a total knee replacement, but to wait till I'm over 50 because insurance only covers one. I already had 2 knee scopes. So that's not true. Insurance will cover your knee replacement. If you have arthritis and you have knee pain and you have bone on x-ray and your quality of life is affected, then you qualify for a knee replacement. Now, there's been a lot of this type of things where in like Canada and other places, they're trying to delay knee replacement surgeries. In the US, if you're 50 years old, you have arthritis, you're indicated for a procedure. So I would take care of you or get a second opinion. What is the next step after a lateral release surgery and still having pain? So if you have a lateral release, it means your patella is not tracking properly. If your patella is not going the right way, you can do different things, meaning you can cut the bone and shift the tibia bone over where that patella goes in, where your patella tendon goes into the bone. That's one thing you could do. There's other Mpfl reconstructions, which means ligament reconstructions as well, and so those are other options. So it depends what the problem is. If it's patella maltracking, there's a lot of different options. I have European origin for sure, so I'm half Lebanese. Completely torn labrum, is surgery the best option? No, a lot of the times the labrum can get better with conservative treatment. And it depends how bad the tear is, how long you've gotten treatment for. I would try for at least probably 6 months. If it didn't get better, then you could get what's called a hip scope if it's your hip labrum and go in there and try and clean it up. Thanks for the follows. I appreciate it. Why are physicians withholding pain medication? So if my patients have surgery, they are getting narcotics. They are getting a couple different pain medications. Not all my patients take narcotics. I will say, I would probably say about half of my patients, I say, I'm going to send you oxycodone. They're like, I'm not going to take any of that. But they do have it on hand if they need it, because I think pain is very important to control, especially after a big procedure like an orthopedic surgical procedure. Treatment for a broken kneecap in 3 places. So the treatment, if you cannot extend your leg, meaning if you can't lift your leg off the ground and you have a broken kneecap, we call that your extensor mechanism is out. If your extensor mechanism is out, then the treatment would be surgical fixation. If you can extend or lift your leg with a broken kneecap, then you can usually treat it non-operatively. I love your videos. I really want to be a doctor and help people. That's great. Part of why I do this, it's mostly to educate, but if I can, inspire younger people to go into medicine, that's phenomenal. And so I really appreciate that. Thanks for the follows. How long does COVID stay positive with a test and no symptoms? Many people are getting reinfected with COVID. I don't think we have good data on that. We don't have good long-term studies on that. It depends on the test you're taking and how sensitive or specific that test is. So a lot of people, I think there was one person who actually tested positive for COVID for like 400 days, but I think that was an immunocompromised patient. So it depends on the test. It depends on patient factors as well. How do I feel about a gastric sleeve? So some people come to me and they're very obese or very overweight. I feel like a gastric sleeve is a pretty aggressive procedure to lose weight. I really recommend diet and exercise if you have a higher BMI or are morbidly obese. And so the problem with the gastric sleeve or procedures that affect your stomach or making them smaller may mean you need long-term nutritional requirements or vitamin requirements, and so that can be a big issue with that. Ever heard of an oncologist diagnosing terminal cancer with no PET scan? Yes, so there are different types of cancers that can be seen on MRI or other types of scans. If you have a scan and there's a lot of metastasis, then it's a stage 4 cancer. If it's a stage 4 cancer, then the prognosis is pretty poor. Especially depending on the type of cancer. Some other cancers are more aggressive, like lung cancer and pancreatic cancer. Those are 2 very, very aggressive types of cancers. Can you talk about piriformis muscle tightness? Yes, I can. So the piriformis is a muscle that's near your hip. It lies right on top of the sciatic nerve. It helps with some external rotation of the hip. And it has a very large tendinous portion. And if that becomes tight, it can irritate the sciatic nerve. It can be a cause of pain for some people. That's called piriformis syndrome. And so sometimes deep tissue massage or physical therapy can help with that. How fast is your tourniquet time for a total knee? My tourniquet times are about 30 minutes for a total knee replacement. Let's see. What's the most common type of cancer? So the most common types of cancer are colon and lung, and then breast. But prostate is not too far behind as well. I'm not a cancer-specific doctor. I'm an orthopedic surgeon. I've dealt with bone cancers in the past, but as far as the kind of most common cancers, bone cancers are not the most common types of cancers. They're more rare. Will wearing a boot heal a sesamoid break? So most of the time, sesamoid breaks heal up just fine without any type of surgical fixation. So I would say yes, a boot will help it, and it can help that sesamoid bone to break to heal, that break to heal and calm down. All right, let's see what else. Yeah, if you guys, so my main specialization, I take orthopedic trauma calls. So I do a lot of orthopedic trauma cases. My main specialization is hip and knee replacement though. So what is hip dysplasia? The word dysplasia just means it didn't form right. So usually something that's dysplastic didn't form right, either at birth birth is kind of the most common form of dysplasia that we see. A lot of the times we'll see a shallow or a very deep hip socket, or a hip socket that's more prone to something called impingement, femoral acetabular impingement. And that can be what is called hip dysplasia. And so there's many risks for hip dysplasia. It can make you more prone to developing early arthritis. Do you have experience with Ehlers-Danlos syndrome? Yes, I do. I do see a lot of patients with connective tissue disorder, especially hypermobility, EDS. The problem is EDS is probably one of the most debilitating conditions. It can manifest with a whole bunch of problems. It can manifest with things like Pott's disease or mast cell activation syndrome. And you may get MRIs or scans of your hips or knees or back, and they may come back perfectly normal, but you still have joint pain there. So people with EDS get a lot of issues. They can have early hip problems, need early hip replacements, and they don't do as well after surgical procedures. So EDS is a very difficult condition to live with. Do robotic knee surgeries make recovery easier? No. Robotic knee surgeries take longer time. You actually have to put extra pins in the bone, and so it's a longer time, sometimes a bigger incision or extra incision. So I only use what I call GPS or navigation knee replacements in like very severe deformity situations. I got diagnosed with mast cell activation syndrome yesterday. Yeah, so it's very common with EDS and Pott's disease. Daughter tiptoes and she's in her 20s. What can I do to help her walk flat-footed? If she's 20 years old and she's still walking tiptoed all the time, then the treatment would probably be an Achilles tendon release or what's called a gastroc recession procedure. I would probably see a foot and ankle orthopedic surgeon to see if they do that procedure. What's my favorite operation to do? I really love direct interior hip replacements, and I really love knee replacements. Where am I located? I'm located in Washington, D.C. and Maryland. I do telemedicine visits. There's a link in my bio with kind of all my info. I'm starting a healthcare Discord channel as well, so that's in my bio. But I really appreciate all the support for the channel. You guys have helped this grow, and that's been great. How long is a full recovery for total hip replacement? Great question. On average, I will say people make about 80-90% recovery by about 8 weeks after the operation. And you make improvements after the hip and knee replacement, even 6 months to a year after the operation. But most of the improvement for that procedure is actually within the first 8 weeks. Thanks for the follows. Thanks for all the double taps and likes. I appreciate it. What other options can you give me? I don't know what's going on with your problem. So let's see. These questions are flying in here. I had a total knee replacement. Month later, cement was found floating. Is this normal? It is not really, the knee can be cemented into place. If it's cemented into place, there can be cement maybe in the back of the knee. It's very rare depends on cement technique and how you do the knee replacement. I'll say even if you see a little bit of extra cement, either floating or in the back of the knee, it's very rare that it would ever cause any symptoms. It wouldn't warrant something like a revision or anything like that. If you're having pain, it's probably not due to the cement. It's probably due to something else. Plantar fascia relief. So if you have plantar fasciitis, it's a very common condition. I would take a tennis ball or a golf ball, roll it around on the bottom of your foot. Plantar fasciitis tends to be most painful when you wake up in the morning, when you take a couple steps, you have intense heel pain. Anti-inflammatories can help. Stretching Achilles can help, and using a ball on the bottom of your foot can help. So all those can be really helpful. You could do a physical therapy session for Achilles stretching as well. Is it normal to have pain and tightness in my knee 8 months after your second Mpfl repair? The question would be, why did they do a second one? Did the first one fail? Anytime you have a revision surgery, recovery can always be a lot more difficult. So that can be challenging. Dequer veins, tenosynovitis relief. So find out why you have dequer veins. A lot of people who either get new pets or animals, or if you're a new mother or parent holding a baby, it's very common to get dequer veins on the first extensor dorsal compartment. You can get an injection there if you're having a lot of pain. And a thumb spica splint can also work pretty well. You can order those on Amazon. I have a link to some thumb spica splints in my bio through my Amazon store if you're interested. Also, if anyone is undergoing a hip or knee replacement, I have great guides for that on my website. They're perfectly free. Knee replacement, post-op 4 months, robotic used, recovery time has been difficult. Yeah. The robotic surgery has 4 extra pins that are put in the bone. You're not always told that. It can be an extra incision. So for me, I've seen great outcomes on my patients without using the robot. So, if people are getting good outcomes, why change what you're doing or what we've done for a while? Until the robot has kind of gotten to the next level where it shows better clinical data or better clinical outcomes, then for me it's just not worth using. But yeah, if you guys have questions, drop them in the chat. Thanks for the follows. I really appreciate it. Possible calf compartment syndrome. Apparently the Stryker needle isn't available for testing. Are you in the emergency room right now? That what you just said is something that would be in the emergency room with compartment syndrome. If you have compartment syndrome, you should be in the emergency room. And you should probably maybe get a fasciotomy. Hey, what's up from Williamsburg? Not too far away. I'm in Washington, D.C. I was down around Williamsburg the other week. Had gel shots. How long does it take for them to start working on my knee? So there's two types of gel shots you can get. You can get a series of just one shot, or you can get a series of 3 shots. Gel can provide nutrition or lubrication to the joint. If you have arthritis, it may not work that well. I would say about 30% of the people who get gel shots get relief. The other 30% are somewhere in neutral, and the other 30% don't get relief. The cortisone shots work the best. Those are usually the best types of injections. AC joint degeneration in a 26-year-old. So you probably have something called distal clavicle osteolysis, maybe. It's very common in people who weightlift a lot. So I would probably change activity, and they can always take away your distal clavicle and actually take away that joint if it's really painful for you. Hey, what's up from Maryland? That's where I practice, in Germantown, Maryland, and Washington, D.C. One of my offices and my surgery center is actually in Maryland. So how's it going? Had a hip replacement. Now your foot turns outward. Is this due to the hip replacement? It's hard to say for sure. So when you have arthritis, your hip can be positioned in a certain way. I use an X-ray when I'm in the operating room during my hip replacements to make sure that everything lines up. And I would say a lot more people actually say their foot is kind of in a straighter direction after the operation. But it's not uncommon if some muscles are stronger than the others. So I would say work with physical therapy, try and get stronger, and see if your foot goes in a better direction. Need a knee replacement, but it's not bad enough yet. It's painful. Any advice? So I would classify your level of arthritis, and probably get a X-ray to see where you're at. If you have bone-on-bone arthritis or the cartilage is worn out, then there's different things you can do, like anti-inflammatories, or you can do things like injections like cortisone or other type of medications can be very helpful for you. Level 4 arthritis. So if it's level 4 arthritis, the really next step is shots. You could do a brace. The only real treatment for that is what's called a knee replacement. It's a knee replacement, either a partial or a full knee replacement. I have EDS, and I've had to have my Mpfl reconstructed back in February. Is it normal to have numbness in your shin? Also, is it common for your other knee to start going the same way? If you have EDS is a connective tissue disorder. It means your tissues are very elastic. It means your patella can be more prone to dislocating. You need a locating patella. And so also surgeries don't work as well in people with EDS. So if you had your Mpfl reconstructed, the only other treatment is really osteotomies to realign the bone, or a revision Mpfl reconstruction. Hopefully, if you need it on one knee, you may need it on the other if it's not a traumatic dislocation. You are so clear and straightforward. Thanks. That's my goal. What do you think of gel shots in the knee? Gel can be helpful. It's to buy some time, hopefully avoid knee replacement for a little while. It won't cure the arthritis in the knee, but it is a treatment if you're having a lot of pain. Have severe pain in the lower back when using my arms above a certain point. They said my issue is, and it looks like it cut off. Lower back issues are the most common orthopedic and actually primary care issue. So we see a lot of that. We see a lot of lower back pain. It could be a herniated disc. It could be a muscle strain. There's different anti-inflammatories we'll use for lower back pain, some physical therapy, some stretching. In the worst case, you could do a cortisone injection in the back. And in a worst case than that, you could undergo what's called a discectomy, or basically surgery to release the nerve. Thank you for sharing. Thanks for all the double taps and likes. I really appreciate all the support for the channel. You guys have really helped me grow, which has been great. 30-year-old has bilateral slap tears and needs surgery. How bad is recovery? I would try everything that you can before going through with a slap procedure. Sometimes you can even try a cortisone injection, but if it's not getting better and it's not healing, then the treatment is an arthroscopy, meaning going in there with a camera, repairing the labrum, and trying to get it to heal. And if you're active, recovery may take about 9 months to a year. But slap tears in young people, if they're really symptomatic, then surgery is the best option if you failed everything else. What's the best MCP surgery for a 40-year-old? MCP, so I'm assuming you're talking about the metacarpal phalangeal joint. If you're talking about the metacarpal phalangeal joint and you have arthritis there aren't that many great treatments. One of the treatments is taking out the actual, there is a fusion treatment. Really, fusion treatment is the best for that. There aren't like replacements of the MCP joint or anything like that. I'm based in Germantown, Maryland. That is one of my offices. I have my surgery center there, as well as I go up there once a week for office hours where I see a bunch of patients. And I also am based in Washington, D.C. I do telemedicine visits as well. I treat people from all over the U.S. I've treated people from California, New York, Canada, Mexico, all over. I've even treated people in other countries who found me online. So my 91 years old, bilateral knee arthritis, what's the best treatment? So 91 is a number for your age. It doesn't mean you're physiologically 91 years old. And if you're 91 on TikTok, you're probably pretty spry. So I'm assuming you're probably like a family member is 91 years old and has arthritis. If they're very active, or let's say they seem like they're 80 years old or younger, you could do a knee replacement. If they're sick or a lot of comorbidities or medical problems, I would do a cortisone injection in both the knees. Thanks for the follows. I appreciate it. Any questions, just drop them in the chat. I'll try and get to them. Can you explain what tearing of the ACL is? So the ACL is a ligament in your knee that stabilizes front to back motion of the knee. I can actually show you, let's see what we got here. So this is actually a knee model. The ACL is, let's see if we can see it. So when I'm bending down, you can see the ACL right in there. That's the ACL. It prevents the tibia bone from sliding forward, and you can see the PCL is right behind it. So without that bone helps to, hopefully I didn't break my model. That bone helps to stabilize the tibia bone from sliding forward. If the tibia bone slides forward, that can cause a lot of injuries to the blue part, which is the meniscus. And if you're young and you need that ACL for pivoting, a lot of the times it's torn in a non-contact pivoting injury. And if that happens, then you probably need a reconstruction to get stability in your knee and prevent any type of long-term arthritis from developing. Lumbar fusion for stenosis. I heard it's just a bad idea. I would probably try other treatment options if you can. If you have stenosis in your back, like physical therapy, injections, medications. How long will a meniscus transplant last for? So meniscal transplant is usually done for a much younger patient who had severe damage to their meniscus that it had to get all cut out for some reason, or it just wasn't repairable. I would say if you have a meniscal transplant, you probably will develop arthritis at some point. I saw a lady who had a meniscal transplant in for like 20 years, and then I ended up replacing her knee. So it depends. Everyone has a risk. If you have a really bad injury to develop what's called post-traumatic arthritis or inflammation in the knee due to an injury, and that can be really common if you hurt your meniscus. Permanently broken fibula, what can I look forward to? The good thing is the fibula doesn't take the brunt of the force, the tibia actually does, so you can live with a broken fibula just fine and maybe not have any pain. Sometimes it can scar in and cause called fibrous union, which even though it's not end-to-end bone healing, it may still work. How long did it take to become a licensed orthopedic surgeon? About 14 years of training to get there, 14 years of school. What exactly is facet arthritis? Facet arthritis, the nerves in your back actually come out through a little hole called the foramen, and right next to that hole is a facet. It's a joint, and if that joint in your lower back gets arthritis, that's called facet joint arthritis. It can be a sign of underlying instability or pinched nerves in the lower back. With my Mpfl surgery, they said I had osteoarthritis in my knee due to the constant dislocations. I've had 17 dislocations in 16 years. I've needed the surgery from 16 years and only just got it at 33. I'm sorry to hear that. If you have a lot of patellofemoral arthritis, the first thing is get a kneecap that stays in place. If you get a kneecap that stays in place and you have arthritis, you could get a partial knee replacement or a total knee replacement down the line. Will arthritis get worse? I have rheumatic disease, and will that cause bad arthritis? People with autoimmune disorders are at more risk for developing arthritis in your joints. It's just part of your body actually attacking the joints and the cartilage. I broke my tibia and fibula 3 months ago, and I have pain and severe swelling daily. Should I be concerned? If you broke them both 3 months ago, did they cast you or did they do a nail? If you still have pain, I would probably wait till about 9 months. And then if it still was painful at 9 months, you may need a surgical procedure. I'm 57, I have a pinched nerve in my back. Is it recommended to do a fusion? No, fusion is the last recommendation. I would probably recommend things like cortisone injections first or other treatment options before going through with a procedure. I had a TKR in March. He did it live on TikTok. What surgeon did your TKA live on TikTok? I don't know any, I think I know all the orthopedic joint surgeons on TikTok. I would love to do live surgery and show you guys exactly what goes into an operating day. You'll notice that my videos are not really intraoperative videos, and the reason for this is TikTok kind of shuts you down and blocks your videos if you show an operative video. So I try to make my videos more not show any blood. I would love to do operative videos though. What's the best supplement for RA? So there's good literature to support using turmeric, which is a natural supplement to help with arthritis and joint pain. So there is some literature that just came out recently about that, and so that's something you could look into or check out. Broadstrom 2 times on the left ankle, it hurts. I'm sorry to hear that. Hopefully you don't develop arthritis. I fractured my calcaneus bone in my fibula. Will I be able to jump on a rebounder after it heals? Calcaneus fracture is one of the most painful fractures to recover from. It can take even a year and a half to get better. Sometimes it never feels the same. It depends on the level of fracture, if you develop arthritis in the joints in your foot. So there's a lot of things that go into a calcaneus fracture. Do you have a good opinion of spinal cord stimulators? I have 3. Spinal cord stimulators are to distract you from the pain that's going on, and they may work if you don't have other options. Orthosurgery is rough. All the hospital lawyers would have strokes and lose their minds. Yeah, probably. I agree with you. How many revision knees do you do in a year? I probably do like 2 or 3. Right now I'm probably doing probably like 3 to 5 revision knees a month. So maybe like 25, 30 revision knees a year. Most of the time when I'm doing revision knees, it's a non-joint trained orthopedic surgeon who did the primary operation, and they need a hip and knee specialists to basically take care of an issue that they couldn't take care of. So most of my revision knees are sent to me from other people in the community. Will an unloader brace reduce knee pain? There's not good support for unloader braces. Braces in general can stabilize the knee and help you. It is an option if there's not other good options. I have a torn left meniscus. I'm getting these shots, 1 for 3 weeks. So it sounds like you're getting a gel injection, which hopefully it works for you. Gel provides lubrication, nutrition to the joint, and it can be helpful, especially if you're having knee issues. Where am I? I'm in Germantown, Maryland, and Washington, D.C. I do telemedicine visits. There's a link in my bio where you can find my telemedicine visit link, or I have a website too. So I do treat people across the United States and country. So feel free to pop in for a telemedicine visit. Is popping normal after a total knee replacement? There can be some clicking or some what we call crepitus, which is creaking after a total knee replacement. It's not uncommon. And hopefully that gets better with time. It partially depends on what implant you have. If you have an older generation implant, that may be responsible for it. I would say crepitus is not uncommon from scar tissue buildup. Best thing to do in high school to get into college for pre-med for orthopedics. Just make good grades, try and get on research teams if you can, try and find some orthopedic mentors you can shadow, volunteer at the hospital. Those are all things you can do to boost up your resume. I have a tear in my labrum and a hip strain. I had shots first. What do you think is next for me? Well, usually for hip or labrum issues, we're giving them 6-9 months to heal. If they don't, then the next step would be to go in there with a hip scope if everything failed. Is malpractice insurance expensive for you? Yes, malpractice is expensive for me. I think it's about $40,000 a year for malpractice insurance for me. Where are you again? I'm in Washington, D.C. and Maryland, and there's a link in my bio if you need to do a telemedicine visit. I do telemedicine and virtual visits so you don't have to travel. Can you tell the difference between a sprained or broken ankle without x-rays? No. Sprained and broken ankles can be very similar on physical exam. So you really need an x-ray to diagnose that. You could do something called a ultrasound, but we're not really using ultrasounds to diagnose fractures. We're using x-rays. How long do total knees lay? My patients do not lay after they undergo surgery. After they undergo a hip or knee replacement, they're actually up and walking that same day. Sometimes even 45 minutes after the operation. I do a lot of outpatient or same day hip and knee replacement operations. Why did you choose orthopedics? So for you, whenever you're deciding on what you want to do, you either decide if you want to do medicine or you want to do surgery. And for me, definitely surgery. I love being hands-on. The thing is, I like being able to cure people, and I'm not treating as much chronic disease. Like, yes, arthritis is a chronic disease, but you can cure it with a knee replacement or hip replacement. And so I get people better. I get them up and walking, or I fix their fractures. And that's just very rewarding for me, and I really enjoy that. And I'm not treating like chronic diabetes or things like that, and I love being in the operating room. I'm rebuilding the human body. It is very enjoyable. I got plantar fasciitis after Achilles tendonitis and a calcaneus fracture. Will it ever feel the same? I hope so. Those can be difficult things to recover from. Thoughts on dry needling? I have people who undergo dry needling or even some chiropractic care who they get relief from it. So some people do other things like cupping as well who get relief from it. So if you get relief from those things, that's okay. If you're going to see a chiropractor, do not get your neck manipulated. It's okay to have other joints manipulated. Let's see, both knees replaced 2 years ago. My knees feel very mechanical while walking. Why? I don't know exactly what type of knee replacement they used or what they did during the procedure. The goal for a joint replacement is what we call the forgotten joint, meaning you're not thinking about it on a constant basis. And so, that's our goal. Have you ever done it's a fasciotomy? So that's very close. Yes, I've done fasciotomies. I worked at a level 1 trauma center, so I saw a lot of trauma, a lot of crush injuries. A fasciotomy is where you basically, like if I was going to do a fasciotomy of my forearm, I would make a cut here and a cut here all the way up. And so why we do fasciotomies is if the pressure, let's say my arm gets crushed. If it gets crushed, the pressure and swelling will build up a lot, and you need to release that or all the muscles and the blood flow will die, so you do fasciotomies. How long do total knee replacements last? There's really good literature to support that about 60% of total knee replacements are still intact at 30 years, so they do last a long time. Why no neck manipulations at the chiropractor? Because you have two arteries on your neck called the vertebral arteries. They go through the bone, and if you get your neck manipulated hard enough, those vertebral arteries can tear. If you tear one, you can get a stroke. If you tear two, you can die or be completely paralyzed. And if you just Google patients paralyzed after a chiropractic neck manipulation, you are going to see a bunch of articles come up. So I've had people come to me and I've had to see them or treat them after they got their neck manipulated and just avoided any relief you can get from it. It's not worth suffering a stroke. Is there any fix for drop foot? There's a couple different things you can do for a drop foot. You can wear an AFO, meaning a custom orthotic to keep your foot at neutral at 90 degrees. You could do tendon transfers. Tendon transfers are usually only done if you're very young because it's hard to recover from that if you're older. If I had a foot drop, I would probably just wear an AFO brace or a brace for my foot. Do I believe in chiropractic medicine? There's not good literature to support it, but I do have patients who go for chiropractic treatment and they get relief. So I think anything you get relief with is worth trying. I would just say avoid neck manipulations. Did I do a fellowship? Yes, I'm a hip and knee trained specialist. I did a 1-year fellowship in hip and knee replacement. Thanks for all the questions. Thanks for all the support. Let's see what else. The UK, the doctors tell us knee replacements only last 10 to 15 years. How come you say they last longer? Well, in the UK, I believe it's socialized medicine, and so a surgeon can only do a certain number of procedures a year. And so if a surgeon can only do a certain number of procedures a year, the goal is to delay your procedure as long as possible. That's why many people in the UK and Canada get told by their surgeon they're too young for a joint replacement operation and that they only last 10 to 15 years. That is not true. There is very good literature to support that hip and knee replacements, 60% are still intact at 30 years. So that's over half of all hip and knee replacements that are done in the US are still intact at 30 years. So it's a tactic to delay having surgery, basically. I had microfracture surgery when I was 50, then a knee replacement because it messed me up. You know, microfracture procedure is an operation to try and create some fibrocartilage, to try and generate some healing. You know, it doesn't always work, and sometimes you may get worse arthritis from it. 25 years old, am I a candidate for shoulder replacement? I would probably say avoid shoulder replacement. Shoulder replacements do not last as long as hip and knee replacements, and so you want to wait as long as you possibly can. Thank you for helping me make the decision for bilateral hip replacement. I feel awesome. That is great. You know, what I'm on here to do is educate, help people feel more comfortable with decisions, and you know, I'm really glad you're feeling well. Oh my God, I've been lied to institutionally. That's funny. Sorry to be the bearer of bad news. I'm going for knee replacement and my doctor wants me to do it as an outpatient. Great. I do probably 70-80% of my joint replacements outpatient. It's better to recover at home. That's a lie. It's not a tactic to delay knee replacement surgery. Look, medicine is practiced differently in different countries. It depends where you're practicing and geographically. You know, some people in other countries have waits of 5 to 6 years for joint replacement procedures. And, you know, in the US, it's, you know, if someone came to me and they were like, Doc, I just have to get my knee done as soon as possible, you could get it done in 4 to 6 weeks if you really want to. What is orthopedics? Orthopedics is the study of muscles and bones and and tendons, and so that's what we deal with ligaments, muscles, bones, tendons. Yeah, I do telemedicine visits. I have many people who travel for surgery. There's a link in my bio. I also have great guides for hip and knee replacement in my bio. I had a total hip replacement, and I still have a ton of groin and back pain. I would get maybe an MRI of your lower back. I would also maybe get a second opinion for your hip to see if there's any issues or anything's out of place. I have a TKR and I have now ossification. What would you recommend? So if you have a total knee replacement and you have kind of calcification or ossification, it depends if it's limiting your range of motion or not. If it's limiting your range of motion or causing you pain, then you could always sometimes get it removed. But if it's not affecting function, I probably wouldn't recommend a revision knee replacement. Are revisions due to infections or oversizing or undersizing? I would say revisions are not usually due to oversizing or undersizing. You could do a revision for an infection. Thank you for all the double taps. Thank you for the follows. I appreciate it. I got a bunch of great links in my bio for guides on hip and knee replacement. Greetings from Brazil. I'm in med school here, and you are an inspiration to me. I never really liked orthopedics, so I started watching your channel. That's great. If I can show people what orthopedics is about, I think it's like the best specialty because it's very enjoyable. And, that's what I'm here to do. Spine or hip surgery first? Definitely hip surgery. Hip surgery is easier to recover from. And sometimes after hip surgery, many of my patients have gotten better from their lower back. What state am I from? I practice in Washington, D.C. and Maryland. Do you think chiropractors do more harm than good? I would say no on that fact. I think in general, chiropractors do more good. I know many chiropractors are taught not to do specific neck manipulations. I think it's just a thing for neck. Where do I click to see your bio? You can click, I think in the top corner is my username, and it should bring you to my bio, and it should be listed there. It's MatthewHarbMD.com/links to get to all my links. TikTok's done something weird, so you can't always see the links in bio anymore, but I wrote it out for you. I had both knees replaced in 2015. It was a blessed relief. That is great to hear. I love success stories like that. That is what, as a hip and knee surgeon, what I aim for, to give people quality of life, to give people function back. Do you know what a drop foot is a sign of? A drop foot is a sign of sciatic nerve injury, or of it can also be peroneal nerve injury as well. We're usually doing brace for that. Injections do work wonderfully. I agree with that. Injections can be very good. The orthopedic surgeon was the only one who knew what it was and how to treat. So one of the things about orthopedic surgeons is, in order to become an orthopedic surgeon, you have to be like the top of your class. You have to be very competitive. So, the stereotype is that we're all brutes and, we just like to mallet things in place. But, that's not true. Most of us did. I mean, it's partially true, but most of us did really well on our exams. We were top of our class in med school. So all orthopedic surgeons are usually pretty smart, even if it's not just for specifically orthopedic needs. So, they can help make a diagnosis or help get you to the right place that you need to be. But that's one thing. So if the orthopedic surgeon was the only one who diagnosed you or could treat you, that's great. I'm really glad. Hopefully you get better. Yes, a drop foot is a sign of a nerve injury. What do you think of 10x and golfer's elbow? There's not a lot of great literature on 10x. What I would say is probably try a cortisone injection in your elbow first, compression, NSAIDs. If all that fails, you could do a 10x. Make sure they're careful of the nerve, and if you need a release, a surgical release, that could be done. But I would probably try 1 or 2 cortisone injections. Yeah, if you feel like you asked a question and the video froze, just ask it again, drop it in the chat, I'll try and get it. Do I perform SI joint fusions? I usually recommend against SI joint fusions. I've seen people get a lot of issues with them. Do my knee replacement doctors in Kansas refuse to do my knee replacement because my age is 28? I will say 28 is pretty young for a knee replacement. I have done people even sometimes younger than that, but it's very rare. You really need to have end-stage bone-on-bone arthritis from either a traumatic injury or something like that if you're really that young, because you will need a second or even third procedure if you're that young. Drop foot from a broadstrom surgery, so maybe there was a tendon injury or not such, but usually drop foot is a nerve injury. Is going into private practice still worth it? That's a great question. You know, reimbursement is decreasing. As inflation goes up, physician reimbursement goes down, and cost of overhead goes up. So it doesn't make a lot of sense, but that's the world we live in. So at some point, private practice will probably not be worth it. You know, right now, it's I get to control my schedule and control everything I do, so I enjoy private practice for that purpose. There's pros and cons to working for yourself or being employed by a hospital. DePuy or Zimmer. I use some DePuy products for my hips. I'll use DJO a lot, and I'll use Stryker a lot. Is surgery the only fix for a meniscus tear? No, it is not. You can try conservative treatment with physical therapy, anti-inflammatories, ice, sometimes injection. Does popping your fingers cause arthritis? You should check out my, oh, maybe I didn't post that on this. Maybe that was on Instagram. Cracking your joints does not cause arthritis. Favorite brands of scrubs. So these are Figs, but I took off the logo because I didn't want to, sponsor them. Most of the time I'm in hospital scrubs, and hospital scrubs are not really branded scrubs because whatever hospital or surgery center you work at, you have to wear their scrubs because they're clean. You pick them up in the operating room. So most of the time I'm not wearing scrubs to clinic. I usually will wear dress pants or a suit, and so that's my clinic attire. When I go to the hospital, I usually change. How successful are ankle replacement surgeries? It depends. If you're very young, an ankle replacement surgery could be a little bit more difficult to recover from. Sometimes you're doing a fusion surgery instead. So it's a variable recovery. I would talk to your surgeon based on what implant they use. My total hip is now 32 years old. That's awesome. I hope, I usually recommend getting a checkup every 5 years to see if there's any wear on the plastic piece. But that's great. That's an awesome outcome, 32 years. Treatment for drop foot would be a brace. You could do tendon transfers, but usually it's just a brace. Stryker is the type of knee replacement she had first. She's had 3 total knee replacements so far. I'm sorry to hear that. All the implants that are out there, there's pretty good longevity, but equal longevity. One's not superior to the other. There is changes in surgeon technique, meaning how the implants are put in, and so I'm sorry it failed. There is a risk of loosening or infections over time. Fun fact, if you remove your eyes, you will see the real world. We live in a simulation. Maybe you're watching too much Westworld. How is my work-life balance as an orthopedic surgeon? I enjoy my work-life balance. I am in private practice, so I have a pretty good work-life balance. And I would say if you're employed, you may have to work 5 days a week, whereas if you're in private practice, you can kind of make your own hours. Do you know about limb lengthening surgery? Is this surgery available in the U.S.? Yes, it is available in the U.S. People are doing limb lengthening surgery for basically cosmetic limb lengthening surgery because they want to be taller. I would say avoid doing cosmetic limb lengthening surgery. I think it's like some people charge like $100,000 to do it. There's too many complications that can happen. Don't do it. How many hours of call do you take? My call schedule is basically what I want to take. This next 6 months, I think I'm only taking a week of trauma call, so 7 days. I'm usually on for like a 7-day stretch where I cover, so whatever 7 times 24 is. For total knee replacement, what's the best anesthesia to have? The best anesthesia for total knee replacement is a spinal anesthetic. Do I do surgery on children or just adults? Mostly right now I'm just operating on adults. I have operated on children in the past, but currently just operating on adults. Radiofrequency ablation is a procedure to numb the nerves, usually around the knee if you have chronic regional pain syndrome or things like that. Is it too old to try and get into med school in your 30s? No, it is not. The actual average age for getting into med school is something like 26 or 27 years old. So you're not too far behind or anything like that. Post ACL, 3 months. When can you do squats? You start doing running and things like that usually around the 3-month mark. So you should be picking that up, working with therapy, starting to get more agility and more aggressive. Should you be out to sleep for the knee replacement? I don't want to hear or see anything. So even with the spinal anesthesia, you're still asleep. You're just not fully, you're breathing on your own. So it's a light sleep. You don't wake up. You don't know what's going on, but you can wake right up after the spinals and the medication stop. But you're breathing on your own, so you don't need a tube down your throat. So I do all my joint replacements under spinal anesthesia. Is biomedical engineering a good major for pre-medicine? I would probably say yes. Medical schools like the kind of alternative medical route. I'm going to have surgery on my lower back due to scoliosis. And my last one was horrible. That's a big operation. Hopefully, I wish you a speedy recovery, but that is a big procedure. I appreciate all the support for the channel, the likes, the follows. They keep the channel growing. I'm going to try and do more of these lives. Check out my links in my bio. I have a Discord channel. If you have more questions, just drop them in the Discord channel and I will try and answer them. I'm trying to grow a medical community there. And I'll do more of these lives. And thanks for tuning in.